So I've been told, hypothetically, I have a fatal disease after I've gone through a battery of tests here and the diagnosis is confirmed by a PET amyloid. And I qualify for a double-blind clinical trial in this facility. And all of a sudden I change my mind. What are some of the reasons that patients offer up why they do not want to be in a program which may be their only possible way of delaying this disease?
There are many reasons why patients change their mind even after reading the potential benefits, potential risks, and even alternatives, which means to do nothing but let the disease march on. Probably the most frequent reason people change their mind is that they say, quote, "I don't want to be a guinea pig, Dr. Ross," unquote. And to that I simply say, if you had cancer, wouldn't you want to do everything possible to try to extend your life and improve the quality of life? Their answer, Mark, is, well, cancer is different. I can feel the pain of cancer, or I can see the jaundice in myself, and I want to see if that can be improved. Alzheimer's is a silent killer in that you don't feel it in the brain. The brain itself has no pain fibers, but it's probably the most painful disease I, as a physician, could ever diagnose and treat. But patients are told there's nothing more that can be done. So being a guinea pig is their first fear. The second most common fear they have is they read the informed consent form, and it talks about possible side effects. One of the side effects could be swelling of the brain. In an attempt to try to remove the plaque, some swelling could occur. It has not been reported to be a fatal side effect, and it's a very low percentage. Yet patients say, I don't want any drug that can cause any side effects. Yet, as you said, Mark, they're dealing with a fatal disease, but they don't want to understand it or admit it. If they had cancer, they would take the chemotherapeutic side effects: hair loss, diarrhea, hospitalization, blood loss, anemia, bone pain from the treatment. We don't have those types of side effects in the many drugs we're studying. But it's the fear of being a guinea pig, or as one patient told me recently, actually it was a patient's child, I believe it was the daughter, that said, you can test these medicines on someone else's father. Yet the patient himself wanted to do it, but you need what's called a study partner in these studies. So again, it's fear of being a guinea pig, fear of side effects, and a third is they say, well, I don't want to be on a placebo. A placebo means a sugar pill, no active ingredient. In these studies, we must compare the safety and benefit of the active drug to a placebo. Failing to do that may show that a drug has benefit, but perhaps the patients would have responded as well to placebo. Let me explain that in a little more detail. Years ago, there was a drug called thalidomide. Many of my older viewers here can remember that drug was not tested against placebo. It was the pill used to control morning sickness of pregnant individuals. And it turned out, because it wasn't studied in a double-blind placebo trial, individuals were born without limbs. They call them flipper seals. The technical term is phocomelia, flipper seals. Had the study been done in a placebo-controlled trial, it would have been stopped, taken off the market, and many, many individuals born without limbs would have been avoided, and the drug would not have been given. So I strongly urge patients to think about what they can do for themselves, for their family, and leave a legacy by being part of the cure, not part of the problem.